Oh, you have to sign one of these? Over here. No.
There's a CNA nurse meeting documents too, but I can't ever do it with you.
Okay. Do you know that, Lisa?
No, CMA.
I'm sorry,
CMA.
Oh, CMA. Look at it. I got that. Please, CMA. My ears. Or I think my ears playing.
I can take you home, I'll go that way.
She said, I need you to take, roll with me to, okay, tire shop to get the other car, take it up to the house. I said, okay. And she said, I guess when you have to be. I did.
Well, it's faster. Yeah, I can't get mine.
No, I'm go home and get them.
You really pushed that all the way down my hallway?
Let me see that.
You're supposed to produce them.
Nobody wants to send near me, huh?
Do you know there's a prize for sitting closest to me today?
Oh,
I'll take my chance.
I was there last.
you're not on one.
I
Maybe I'll be lucky today.
Not saying you're wrong. Gosh, Bailey's on. Everybody get signed in. There are other chairs, ladies.
All right, Joe.
Yep. Somebody wants to find me. No. You have anything, so. Let's go. Sarah's gonna say it. And turn out a few minutes. Everybody get their snacks. Okay, we're gonna get started, because I know you guys love sitting around here in anticipation, right? So this month we're doing infection prevention, bloodborne pathogen, and red bags. Since we just had skills fair for nursing, I'm not gonna go through all of our infection prevention stuff, but I will go through some more of the generic stuff that pertains to everyone. But first, we gotta take care of business. One thing that got brought up lately is doing people's hair at the table. Like, it was in regards to Levon, like somebody went and even got her hair brushed and all that and is brushing her hair out at the dining room table during mealtime. Let's not do that. Huh?
Was that me?
No. No. Just take her to away from the table at least. There's the living room, there's hallways, there's places to go if she wants her hair, if you want to do her hair, okay? Infection control, right? Bussing tables. It's important that we're getting those taken care of as soon as we can, after a meal's done, just because a couple of reasons. One, it holds laundry up if we're not getting them their tablecloths and stuff. And two, I hope you don't just leave food out at your house just sitting all over the place. So when I hear we're pushing 10:30 and we still have dishes all over our dining room tables, let's make sure we're getting out there and getting those taken care of. Okay. Okay, give me a 5-minute rundown on nursing home week, Mary Jo. It's coming up the week of
12 through, or 13 through the 18th.
Okay.
Okay, we're gonna have a theme each day. And I don't have my computer, so I can't tell you what the theme is. Elvis will be finishing off the week on Friday. Thursday will be one that everybody, well, I'm trying to include you guys every single day in some way. But Thursday is gonna be pajama day for everybody. That doesn't mean we wear negligees and we don't bend the rubber fingers.
Just make sure they're clean and presentable. We don't want the ones that you spend 22 hours a day on your day off and that have probably been needed to throw away for a while.
Long time ago.
Yeah, we're talking, you have cute little pajamas. We're kind of going we had a couple other ideas as well for things on that day.
Something like, and all this information will be coming out the next week, like on pajama day, the community would bring their favorite bedtime storybook to donate, and we'll donate it to Kids Corner or Mrs. Lacey, our preschool that comes here every month, or the elementary. So that would be a way to bring in our community, our residents, our staff, the whole 9 yards that day. Each day there'll be some kind of food, as most of you all know. Monday is minute to win it games. Staff can play those as well. There are prizes for everybody. Tuesday, I believe, is a memory day, and that's really important because we're getting pictures of all of our residents when they were very young. I would like to do it with staff as well, so if you could bring me a picture of yourself, by yourself, when you were young. Most of the residents don't have anything like before the age of 15, and that's fine. So I'll take any childhood picture of yourself and pass the word. Because then we're gonna have a contest. Who can guess who? So bring me a picture. One of these torch tree.
Yeah.
So they're good, yeah, could be a lot more, could be a lot.
Yeah, so just keep that in mind. We'll definitely be celebrating both our residents and staff that week. Ending in Mother's Day that weekend, right?
Mother's Day.
Oh, it's the,
everything.
yes, it's the Friday
Friday
before.
before, we're having a Mother's Day tea from 1 to 4. I'm also bringing in a photographer, anybody that was here 50 years ago. So we set that up in the dining room, and moms can take pictures with their babies. And I'm just gonna, Gail, there's clearly not a mom, so I told Gail that she could have her sister's phone, and we could get a picture of that for her siblings, that kind of thing. So that day, we're also doing headshots. Megan, you can talk a little bit about that.
Oh, as for department heads, we're redoing our
Headshots for department heads.
Yeah.
Okay.
that Friday.
Friday the 10th, the day before Avery's. I'll do stuff with Claire or Mel for you.
Or if you just wanna keep the one we had before, that's fine, we
My hair is even the same color. I'd love to keep that one, yeah.
It's just, we have so many new department heads that I'd really like to get our website updated, okay? T-shirts. So when I went to order this last round of T-shirts that we were doing, they didn't have enough of all the sizes. And I meant to bring down the flyer. It's sitting on my desk, but it's a similar shirt. It's a happiness shirt of some sort. So I'm gonna take a majority. Do you guys mind if we order that one instead?
I'm good with it.
That purple shirt you had last year,
No, we had done,
you thought was blue?
that we had picked out one and I don't even remember what it said now.
Positivity.
Yeah,
In the workplace.
and this is a very similar, I think it's a kindness one, so,
Oh,
Mary Jones.
yes.
Okay.
So I will,
wear it.
that will come in May.
If
Okay.
you didn't order it from me, this was one that everybody paid for themselves. So if you didn't order the positivity shirt from me, then you're not gonna get this one unless you say something.
I thought that you signed that paper, didn't
What?
Yeah,
you? Paycheck deduction.
yeah, it is.
Yeah, if you already ordered it from me. Okay,
We'll just use it for this one instead of.
But if you didn't order that one, you're not gonna get this one unless you now tell me.
Which I'm probably gonna put that order in this.
What color?
It's sitting on my desk. You can come look at it. Okay. Tosh, Sam's on. Okay. Come on. Oh, one more thing before we get there. Why is this not? Our enhanced barrier precaution stuff is now in place. Since Jim's out right now, I don't have one in there because we're one bag short, but if and when he comes back, I'll make something work for him. So just a few key points. Nothing has to be red bagged, okay? So gloves can just go into the regular trash can. The gowns, there's a trash can. Right now, they're inside everybody's rooms. They can just go into those, and then laundry, they're washable. They wash up to 12 times, I think.
Yeah, that's the least acceptable part.
Yep.
This is for who?
The enhanced barrier precautions are people with tubes. So four people right now, Ed, Jim Johnson, Mary Push, and Lisa.
And it's only if you're dealing with.
It's, so if you're going and passing waters, you don't have to do it, but if you're transferring them, you do. If you're transferring them in the dining room, you don't have to. But if you're transferring them in their room, you have to wear glove and gowns. So that even with changing their clothes, housekeeping, I think it's only when you're changing linens, correct? Is that what you would say, Joy?
Yeah.
And Sherry? Just when you're changing linens. If you're vacuuming, cleaning up their room, whatever, you don't have to wear them, okay? It's just anytime you may come in contact with their fluids. Okay,
So why, how can you transfer the name?
because it's a dignity thing. Don't,
Therapy will wear them.
therapy will have to wear them. We don't need to have the discussion again of our thoughts on this, but here we are. They're all hanging on the back side of their doors. So we're trying to make it as discreet as possible for them. Ed was excited about it. Lisa was not excited about it. So just, that's officially in place. Any questions on EVP? Okay. Let me see if this works. What is this? Okay. I just wanted to switch slides. Uh, difficulty. Share screen. Maybe just share this one. I want it on that up there. So first we're starting to, on infection control with the different types of isolation. So you're gonna have your standard isolation, your standard precautions, I should say. I have a video on that, so I won't go a whole lot into it, but that's your typical, when we're doing periphery, you wear gloves, when you're changing, what do I wanna say, when you're passing meds and you're doing injectable, you're using gloves, like it's your standard precautions of everyday nursing use. Okay, your droplet precautions are your, it's, the coughing and, so that is, you're using your mask and either goggles or face mask for, face shields. That's only if we have them in actual droplet precautions.
When would someone go into that? We don't even test for it, how would we know?
We do. We don't look for it.
Well, that's different.
And there's been other times that somebody might have like a contagious pneumonia or something, and they've had us put them in droplet precautions just to help not spread it, and influenza, things, RSV. And then the last one, and that's when you're gonna use your glove gowns and face masks. Those are gonna be more of your,
Contact is just, yeah.
Oh,
Are you talking aerosol?
I have standard, droplet, and contact.
Contact is.
Oh, that's not changed, oh, aerosol.
Aerosol, they need to be negative pressure.
Yeah. So the likeliness, we're not gonna probably have that here, but it is a type of ice. Okay. Turn it off and turn off the TV.
Yeah. That's weird. It's like it's locked.
Yeah. Before we go into videos, it's on a slide up here, but I'll keep moving. So red bag procedure is part of our infection control policy, but, so if somebody is in one of these precautions, not our EVP, but in actual isolation for some reason, for COVID, RSV, influenza, whatever it may be, where do we put red bag laundry? We walk it downstairs. It's never
Downstairs in the red box.
goes down the chute. Okay, you walk it downstairs. There's a fancy little picture I have up here of the square as to where, in between the two washers, where that red bag goes. That's for linen. For your trash when you're in isolation, there's a procedure that is on top of the barrel. Go downstairs and you take a left into the storage room. There's two big yellow barrels, and see now he's breaking stuff.
I am not.
Uh,
That's a pretty good catch though.
yeah, she'd kill you if you broke that. There's a
Anyway.
procedure on how to put the trash in, and if the trash is full, make sure you follow that to close it up. We're not doing the like fold over to close the box. You actually close the box and then take it. Okay, but on top of those barrels, there's, you don't know how to do. If you remove a box, it goes out to the garage and you put a new one in. And that's your responsibility. The next person taking trash out doesn't wanna come down and say, oh, nobody put a new box in, so now I have to go through that whole process. Type of thing. They will still have insulation bags, there'll be a sign outside the door, and trash barrels. Anything else on red bags that my nurses think?
Oh, this, like, in the front of garbage shelves, if it's not actually saturated and saying it can go in the regular trash, they kind of changed the wording for that a couple of years ago. So, because red bagging stuff is extremely expensive for us to get rid of, so we want to reduce as much stuff in the red bags as possible. Yeah. It's really different.
Yeah,
Has to be like.
it doesn't,
Nothing.
yeah. Back in COVID, we red bagged everything and we would have like extra pickups by biohazard, like boxes for days. And so luckily, the last time that, we, they were supposed to come pick up, I actually called back, I said, I don't have anything to pick up. So we have flipped from everything being, needing to be rebagged to now hardly not anything. That looks more like what I'm used to. There we go. Okay. So this is the, thank you, Darren.
Gotta pay off or something.
So this is our red bags. So then every bathroom should have one of these hanging bags in it. So if there is something that comes up and you do need a red bag something, it's in every single bathroom. If you see that it's not, please let us know so we can replace it. These are the hanging bags. I'm sure you guys have seen them. This is what's on top of the barrel that shows the procedure on how to do the boxes. And this is specifically where you place the linens. Okay. Questions on any of that? Okay. Now I need to switch to my videos. I have a couple videos to watch. And then you guys are. How about I stop sharing? And then I go back and share. How about that?
Well, let's try this, shall we?
I'm done with all that. You can close out if you want.
Maybe. Maybe not.
Oh, there we go. Yay. Okay, so this first one is on bloodborne pathogens. It's very, very exciting, probably more exciting than me speaking. So, enjoy.
Or if someone works you need to be aware of these dangers. Exposure Types of diseases caused by blood-borne pathogens include human infectious, which leads to HIV/AIDS, hepatitis B virus, HB, hepatitis C virus, HCV, Ebola, malaria, syphilis, and brucellosis. Understanding how each of these infections is contracted and spread is incredibly important in order to ensure the safety of those who come into contact with them. Once we know that hepatitis B, malaria, check out our hepatitis B, Ebola, or malaria medicine. Taking preventative measures, such as wearing protective clothing, is one way to minimize potential exposure to these frequent dangerous infections. OPIM is a term used to encompass a wide range of materials, which could be potential infections in the appropriate safety protocols. It includes, but is not limited to, bodily fluid, semen, vaginal secretion, cerebrospinal fluid, brain fluid, fluid in joints, pleural fluid, fluid in the membrane of the lungs, pericardial fluid, fluid amniotic fluid, so that's transplant or babies during pregnancy. It can also include saliva and other body fluids contaminated blood. In some cases, it may be difficult or impossible to differentiate between types of bodily fluid, but during emergency response, many other medication fields, OPM, have the potential to spread such diseases as diabetes, HPV, or HCV. Such OPIM includes ionization or organs from living or dead person, cultures from humans, and or experimental animals, and certain substances like cultural films. People who handle OPIM must take extra precautions to ensure their own safety by following proper instructions. I love coming to this office every day. Everything just works here, and the thing that works best is a partnership. Working in certain industries carries an inherent risk of exposure to pathogens, posing a potential hazard to employees in these fields. Healthcare professionals, dental workers, and laboratory staff are among those at highest risk for injury and loss of blood. Further, increased safety precautions should be taken by first responders and emergency response personnel who may need to provide first aid as part of their job responsibility. In addition, law enforcement officers, firefighters, child care providers, janitorial staff, and maintenance workers must take special precautions to protect themselves from such injuries. This also applies to those performing housekeeping duties or working in waste management. Even those providing body nursing and health services require the utmost caution when it comes to blood. Taking additional measures can help minimize the risk that they may encounter while on the job. Since bloodborne pathogens can travel through both sharps and bodily fluids, there are many potential ways to be exposed. Sharps exposure is a major risk that you should consider. It's important to handle needles and other sharp materials responsibly, since they pose a threat to infant health. Some examples of accidental exposure include needle sticks or getting cut through glass, break blood. It's essential to remember that shared needles can also be found. For more information on sharps, please check out our sharps injury prevention. Contact with infected blood or body fluid of another person can lead to contamination. This includes getting blood splashed in the eyes, mouth, nose, ears, or food. Exposure to these pathogens can also occur through contact with an infected blood or body fluids, contact from insults, or even inhaling particles from an infected person coughing or sneezing. While the risk of contamination by infected droplets is often separate, medical professionals consider however, diseases such as influenza, colds, and even COVID-19 spreads. Personal protective equipment is essential for reducing the risk of exposure to blood or other potentially infectious materials in the workplace. PPE includes safety glasses or goggles, face masks, face shields, gloves, disposable vinyl, latex, or gowns, aprons, or smocks and foot coverings. It's important to always inspect any provided PPE for wear or damage before use and report damage to your supervisor. Never use damaged equipment. If you're helping someone with injury or cleaning up biological matter, such as spilled bodily fluids, always ensure to use responsible practices alongside proper to minimize and ensure the safety of everyone involved. While exposure to blood pathogens may not be entirely treated in your workplace, there are things that can minimize your pathogens while at work. And encountering blood or other potentially infectious materials at the workplace. Where applicable, please become familiar with your company's bloodborne pathogens program. If you have any questions about your program, please speak with your supervisor. Make sure that all cuts, abrasions, or open wounds are complete. Speak to your medical provider if you have questions regarding hepatitis B vaccine. Your company has a bloodborne pathogens program. Hepatitis B vaccine should be offered as part of the program. If you have questions about the hepatitis B vaccine in regard to your company's bloodborne pathogens program, please speak with your supervisor. Make sure that you are wearing the appropriate personal protection equipment for any task that involves blood or OPIs. This includes donning PPE before providing first aid to injured individuals. Always treat blood and OPIs as though they are individuals. Follow all your company's policies and procedures for work tasks that involve handling blood or blood and or OPI. Practice proper especially under handling blood or OPIs. Hands should be washed with soap and water for a minimum of 20 seconds. Handle all sharps and or sharp-edged tools in accordance with manufacturing instructions and your company's policies and procedures. Do not share or reuse needles. Dispose of all sharps in designated sharp containers. Store all sharp-edged tools in accordance with the manufacturer's instructions and your company's policies and procedures. Do not eat, drink, smoke, apply cosmetics, including lip balm, or handle contacts in areas where blood or OPIs are being or areas that are contaminated. Clean up all spilled blood or OPIs in accordance with your company's policies and procedures. Many companies tend to use bloodborne pathogens and or body fluid spill kits for spilled blood or OPIs. Make sure that all contaminated surfaces are properly disinfected in accordance with your company's policies and procedures. For more information on bloodborne pathogens spill kits, please refer to our lesson titled Bloodborne Pathogens Spill Kit. Dispose of bloodborne pathogens contaminated material in accordance with your company's regulated waste policies and procedures. For more information on handling regulated waste, please refer to our handling biohazardous waste class.
Okay. Questions on bloodborne pathogens? Do we know where our spill kits are in the building? Where's one of them? North Hall shop. There's one on each hallway. North Hall shop.
And
The coffee room, and there's one on the east hall. In the barrel room,
and blood.
the barrel room.
Yeah.
Yep. So those have everything you should need to clean up any bodily fluids in them. Oh, yeah. They're available for use, but everything's in there that you should, towels, paper towels, spray, red bags, gloves, yeah, all sorts of stuff in those. So there's one on every single hallway, okay? And then, share. There it is. This is a hand washing.
And wash particularly use a template for the continue in each of the steps. To achieve good quantity of foam, then the right palm at the left hand, those fingers. First. Use this to
You know where they don't put.
hands,
I'll tell you, for as strict as they are on how we wash our hands, there sure isn't a lot of videos out there that follow every single rule. But that's your basic, and with hand sanitizer, you rub them until they are dry. Okay. Questions on hand washing? Okay, one last standard precaution, and then I think we're good.
Standard precautions are infection control guidelines that are used in hospitals to reduce the spread of pathogens between patients and healthcare workers. This includes body fluids, non-intact skin and mucous membranes. We create this video to cover the medical definition and provide a brief overview of this topic. So if you're ready, let's get into it. As previously mentioned, standard precautions are a set of infection control guidelines designed to reduce the transmission of harmful microorganisms. By adhering to these guidelines, healthcare professionals can help protect themselves, their patients, and the general public from the spread of disease. The primary component is hygiene. Number 2, personal protective equipment. Number 3, patient care equipment. Number 4, needles, tip, and sharps injury prevention. And number 5, patient placement. Hand hygiene is perhaps the most important aspect of standard precautions. Healthcare workers must clean their hands before and after every patient interaction, as well as after any contact with blood, body fluids, or contaminated surfaces. Alcohol-based hand sanitizers are typically used for routine hand hygiene, while soap and water must be used when the hands are visibly stained or contaminated. Personal protective equipment is another key component of standard precautions. This includes items such as number 1, gloves, number 2, gowns, number 3, masks, number 4, face shields, and number 5, eye protection. Healthcare workers must use PPE when they are in close contact with patients or when they are performing any procedures that could expose them to blood or body fluids. For example, clean gloves must be worn between tasks and procedures. They must be changed to become contaminated. Eye protection must still be worn when performing to prevent sprays and splashes of body fluids from contacting the membranes of the eyes, nose, and mouth. Gowns must be worn when contact with blood or body fluid is likely in order to prevent soiling of clothing during care procedures. If the gown is contaminated, it must be removed and replaced with a clean. All patient care equipment must be cleaned and disinfected between patients to prevent the spread of infection. This includes items such as stethoscopes, pulse oximeters, blood pressure cuffs, and thermometers. Reusable equipment should not be used on another patient until it has been properly cleaned and disinfected. Single-use equipment such as small volume nebulizers must be disposed of after each use. All healthcare workers must be cautious when handling needles and other sharp objects to prevent accidental needle stick injuries. This includes using proper disposal techniques and wearing gloves when handling sharp objects. All disposable syringes and sharps must be placed in a puncture-resistant container for disposal. In some cases, patients with certain infectious diseases need to be isolated in a private room to prevent the spread of infection. Contact precautions which require the use of gloves and gowns when entering the room may also be necessary. Airborne precautions which involve using an N95 mask and naked pressure must be used for patients with airborne infections. Standard precautions are a key part of infection control and play an important role in preventing disease. By adhering to these guidelines, healthcare workers can help themselves, their patients, and the general public safety. If you want to support the channel, be sure to like and subscribe. I would greatly appreciate it. And there should be some other helpful videos popped up on the screen right now. And
Little scary? gonna be with somebody that had like tuberculosis, and that's only gonna be in the hospital. It doesn't allow, I guess, anything from exiting the room. It's a very specialized room, which if we had anybody that came to be, we would be. You're done. So. Questions on anything? Anything you can discuss or add? You want to do drawing? How many prizes we got here, Mary Jo?
F3,
3?
vet S.
You wanna get it?
I touched.
See, she's one of the closest to me.
Melanie Walker. Oh, God, I know one. Say that no more. Kirsten Jans.
There you go.
1, 3, or 5? 3 or 5?
3.
Yes, wrong number. 1. Kirsten just gets the 3. And 5.
We'll hold nurses and our CMAs.
Girls, here, maybe
The rest of you are.
I'll break the camera. Ding dong, Twinkies.
Yeah.
Hi, guys.
Yes.